So here's the thing, going through a negative emotional experience is not always a symptom of a mental illness. Experiencing a difficulty in your life is not always a symptom of a mental illness. Feeling sad is not depression, feeling lonely is not depression, feeling frustrated is not depression. Feeling devastated because you're going through a betrayal is not depression, or because you've lost a loved one is not depression. Feeling overwhelmed because you're heartbroken is not depression. Feeling restless a day or two is not anxiety. Feeling on edge because there's something coming your way and it's a high stake thing is not always anxiety. Not sleeping for a day or two in a week is not always insomnia. Yes, these things might be risk factors for depression, for a mental illness, but they don't always result in a mental illness because they're normal life experiences. They're normal, negative, and difficult life experiences. And a lot of people are able to go through them and come out the other side strong and resilient. It's a pathway to growth. And the reason I'm bringing it up is because in the past, or still going on, some people, because they don't want to sit in the discomfort of these negative life experiences, they use drugs to numb the emotions, the negative emotions. So if you're feeling sad, drink a beer. If you're feeling disappointed, drink 2 bottles of beer. If you're feeling frustrated or you're devastated because you're betrayed, then drink 10 bottles. Drink yourself to oblivion until you can no longer feel betrayed, until you can no longer feel unimportant, until you can no longer feel unloved or unwanted. But now, there's an emerging trend of labeling negative emotional experiences as symptoms of a mental illness. So if you're feeling sad, there's a tablet for it that you can take to not feel sad. Not sit in that sadness and understand what is bringing the sadness, what is causing the sadness. Is it something that you can learn from? Is it something that you can grow from? Is it something that you can fix without medication? If you're feeling frustrated, there's a tablet for it. If you're feeling lonely, there's something you can take for it. And now it's becoming normal that when you're feeling a difficult emotional experience, when you're going through a difficult emotional experience, there's something that you can take that can instantly make it go away. And you see, if we avoid negative emotional experiences that come as a result of negative life events, which is part of normal life, then that is going to challenge our survival. Avoiding negative life events that cause us negative emotional experiences challenges our survival. Because if today I am feeling frustrated and I've used all the drugs I can to not feel frustrated, and nothing is working, nothing is numbing the pain, nothing is reducing the intensity of this frustration, what next? Because if nothing is working, then the next step is I remove myself. And that brings us to the question of suicide. Suicide is multifaceted, and it's a very sensitive issue, which I think we need to talk about in its different facets. We can use 2 categories for suicide. Suicide can be impulsive or deliberative. Impulsive meaning the person doesn't think it through. In the moment, they make the decision and they end their life. Deliberative, they take time to decide. And so if I associate it with this concept of not wanting to sit in the discomfort of difficult emotions, making abnormal out of normal things, thinking that frustration, I shouldn't be feeling sad, I shouldn't be feeling heartbroken, I shouldn't be, yet these are normal emotional experiences, and nothing is helping me reduce the pain or end the pain, then I might just think of removing myself. And so suicide could be impulsive in this particular case. And I think to increase our chances of survival, we need to start encouraging people or reminding people that adversity is part of life. You are going to lose someone in your life. You are going to meet with tragedy in your life. You're going to meet with a challenge or difficulty in your life. That is part of life. You can't remove difficulties. You can't remove negative experiences in life. They're part of it. And if we try to remove sadness out of life, then we're equally removing happiness. They come in a package. Happiness and sadness come together. Because once you're able to bring yourself out of a difficulty, there's happiness at the end of it. Typically, I'm not saying all the time. Once you're able to get yourself out of disappointment, then you're able to see how you cannot get disappointment next time, how to prevent being disappointed next time. So negative emotional experiences are very normal. In some people, in some patients, they might be too overwhelming that they actually break down their coping mechanisms, their ability to cope, to survive, to overcome the difficulty. But not for everyone. A lot of people have in them the strength, the capacity to deal with difficult situations. And it's important that we tap into those capacities for them to be able to deal with the situation and build resilience out of it. Now, if you're one person who's experiencing sadness, who's experiencing a difficulty in your life, try and sit with it a bit. It's not comfortable, it's not easy, it's not smooth, and it's not supposed to be. Because if you're going to experience relief, if you're going to experience happiness, then it has to be preceded with adversity or difficulty. So it is normal to feel sad. It is normal to feel lonely. It is normal to feel frustrated. It is normal to feel rejected, to feel unimportant, to feel disrespected. These are normal, negative, difficult life experiences that cause negative emotional experiences that we are supposed to sit in and deal with as part of life.